Anxiety is a natural human response to stress or perceived danger. It's that uneasy feeling you get before a big presentation or when facing an uncertain situation. While everyone experiences anxiety from time to time, for some, it becomes overwhelming and persistent, interfering with daily life. In this video, we'll explore what anxiety really is, how it manifests, and why it's more than just feeling nervous. Understanding anxiety is the first step toward managing it, so let's dive into how it affects both your brain and body. It's important to distinguish between normal anxiety and chronic anxiety. Normal anxiety is temporary and usually tied to a specific event, like an exam or job interview. It fades once the situation passes. Chronic anxiety, on the other hand, lingers, even when there's no immediate threat. It can become a constant companion, making everyday tasks feel daunting. This persistent anxiety can impact your relationships, work, and overall well-being. Recognizing the difference helps in seeking the right support and treatment. Anxiety shows up in many ways, both mentally and physically. You might notice constant worry, restlessness, or trouble concentrating. Physically, symptoms can include a racing heart, sweating, trembling, or even stomach issues. These reactions are your body's way of preparing to deal with a threat. But when anxiety is chronic, these symptoms can become exhausting. Recognizing these signs is key to understanding how anxiety affects your entire system. Your brain plays a central role in anxiety. The amygdala, a small almond-shaped structure, acts as the brain's alarm system. When it senses danger, it triggers the fight-or-flight response, flooding your body with stress hormones. The prefrontal cortex, responsible for rational thinking, sometimes struggles to calm the amygdala down, especially in chronic anxiety. This imbalance can make it hard to distinguish real threats from imagined ones, keeping you in a constant state of alert. When anxiety kicks in, your body activates the fight-or-flight response. This ancient survival mechanism prepares you to either confront or escape danger. Your heart rate increases, muscles tense, and you become more alert. While this response is helpful in real emergencies, chronic anxiety keeps your body in this heightened state, which can be draining and harmful over time. Anxiety triggers the release of stress hormones like adrenaline and cortisol. These chemicals help your body respond quickly to danger by increasing energy and focus. However, when anxiety is ongoing, high levels of these hormones can lead to problems like high blood pressure, headaches, and trouble sleeping. Over time, this can take a toll on your overall health. Chronic anxiety doesn't just affect your mind, it impacts your body too. You might experience muscle tension, headaches, digestive issues, or even chest pain. These symptoms can make anxiety feel even more overwhelming, creating a cycle where physical discomfort increases worry, and worry increases physical discomfort. Understanding this connection is important for managing anxiety holistically. Anxiety often interferes with sleep. Racing thoughts and a restless mind can make it hard to fall asleep or stay asleep through the night. Poor sleep, in turn, can worsen anxiety, creating a vicious cycle. Over time, lack of rest affects your mood, energy, and ability to cope with stress, making it even harder to break free from anxiety's grip. The gut and brain are closely connected, so anxiety can lead to digestive problems like nausea, stomach aches, or changes in appetite. Some people experience irritable bowel syndrome, IBS, or other gastrointestinal issues when anxious. These symptoms are real and can be distressing, but they're a common part of the body's response to stress and anxiety. When you're anxious, you might notice your breathing becomes shallow and your heart beats faster. This is your body's way of preparing for action. However, if this happens frequently, it can lead to feelings of dizziness, chest tightness, or even panic attacks. Learning to recognize and control your breath can be a helpful tool in managing anxiety. Anxiety doesn't just affect your body, it also impacts your thinking. You might find it hard to concentrate, make decisions, or remember things. Racing thoughts and constant worry can crowd out other ideas, making it difficult to focus on tasks or enjoy activities. These cognitive effects can be frustrating, but they're a common part of anxiety. Living with anxiety can take an emotional toll. You might feel irritable, on edge, or easily overwhelmed. These feelings can lead to frustration or sadness, especially if anxiety interferes with your daily life. It's important to remember that these emotions are valid and that you're not alone in experiencing them. Anxiety can make social situations challenging. You might worry about being judged, saying the wrong thing, or embarrassing yourself. This can lead to avoiding social events or feeling isolated. Over time, these patterns can affect your relationships and support network, making it harder to reach out for help. When anxiety becomes severe and persistent, it may be diagnosed as an anxiety disorder. Common types include generalized anxiety disorder, panic disorder, social anxiety disorder, and specific phobias. Each has its own set of symptoms and triggers, but all involve excessive fear or worry, that disrupts daily life. Generalized anxiety disorder, or GAD, involves persistent and excessive worry about many aspects of life, even when there's little or no reason to worry. People with GAD often find it hard to control their anxiety, and it can affect their sleep, concentration, and overall quality of life. Panic disorder is marked by sudden, intense episodes of fear called panic attacks. These attacks can cause physical symptoms like chest pain, shortness of breath, and dizziness. The fear of having another attack can lead to avoiding certain places or situations, which can limit your activities. Social anxiety disorder involves intense fear of social situations, especially those where you might be judged or scrutinized. This fear can make it hard to speak up in groups, attend events, or even meet new people. Over time, it can lead to isolation and missed opportunities. Specific phobias are intense fears of particular objects or situations, like heights, spiders, or flying. Even though the danger may be minimal or non-existent, the fear feels very real. People with phobias often go out of their way to avoid their triggers, which can limit their activities. Anxiety can have many causes. Genetics can play a role, as anxiety often runs in families. Life experiences, such as trauma or major stress, can also trigger anxiety. Sometimes, medical conditions or certain medications can contribute. Usually, it's a combination of factors that leads to anxiety. Research shows that anxiety can run in families. If you have a close relative with an anxiety disorder, you may be more likely to experience anxiety yourself. However, genetics is just one piece of the puzzle environment, and experiences also matter. Stressful or traumatic events can trigger anxiety, especially if they happen early in life. Major life changes, such as moving, divorce, or losing a loved one, can also contribute. Ongoing stress at work or home can keep anxiety levels high. Sometimes, anxiety is linked to medical conditions like thyroid problems, heart disease, or chronic pain. Certain medications can also cause anxiety as a side effect. If you notice new or worsening anxiety, it's important to talk to a healthcare provider to rule out medical causes. Diagnosing anxiety usually involves a discussion with a healthcare provider about your symptoms, medical history, and any possible triggers. Sometimes, questionnaires or screening tools are used. The goal is to understand how anxiety affects your life and to rule out other possible causes. There are many effective treatments for anxiety. These include therapy, medication, lifestyle changes, and self-help strategies. Cognitive behavioral therapy, CBT, is one of the most common and effective approaches. Medications like antidepressants or anti-anxiety drugs may also be prescribed depending on your needs. Cognitive behavioral therapy, or CBT, helps you identify and change negative thought patterns that fuel anxiety. Through CBT, you learn practical skills to manage worry, face fears, and cope with stress. It's a structured, goal-oriented therapy that can be very effective for many people. Medications can help manage anxiety symptoms, especially when therapy alone isn't enough. Common options include antidepressants, anti-anxiety medications, and beta blockers. It's important to work with a healthcare provider to find the right medication and dosage for you. Simple lifestyle changes can make a big difference in managing anxiety. Regular exercise, a healthy diet, enough sleep, and reducing caffeine can all help. Mindfulness practices like meditation or yoga are also effective for calming the mind and body. There are many self-help strategies for anxiety. Deep breathing, progressive muscle relaxation, and journaling can help you manage symptoms. Setting realistic goals and breaking tasks into smaller steps can also make anxiety feel more manageable. Having a strong support system can make a big difference. Friends, family, or support groups can offer understanding and encouragement. Talking about your feelings with someone you trust can help you feel less alone and more empowered to manage anxiety. Mindfulness and meditation help you stay present and reduce anxious thoughts. By focusing on your breath or sensations in your body, you can calm your mind and lower stress. Even a few minutes a day can make a noticeable difference. Physical activity is a powerful tool for managing anxiety. Exercise releases endorphins, which are natural mood boosters. Whether it's walking, running, or yoga, regular movement helps reduce stress and improve your overall sense of well-being. What you eat can affect your anxiety levels. A balanced diet with plenty of fruits, vegetables, whole grains, and lean proteins supports brain health. Limiting caffeine and sugar can also help reduce anxiety symptoms. Good sleep is essential for managing anxiety. Establishing a regular sleep routine, avoiding screens before bed, and creating a relaxing bedtime environment can all help. If you struggle with sleep, talk to a healthcare provider for support. While it's not always possible to avoid anxiety triggers, being aware of them can help you plan ahead. If certain situations or people make you anxious, consider strategies like setting boundaries, practicing relaxation techniques, or seeking support. Relaxation techniques like deep breathing, progressive muscle relaxation, and guided imagery can help calm your body and mind. Practicing these regularly can make it easier to manage anxiety when it arises. Writing about your thoughts and feelings can help you process anxiety and gain perspective. Journaling allows you to track patterns, identify triggers, and reflect on what helps you feel better. It's a simple but powerful self-help tool. Setting small, achievable goals can make anxiety feel less overwhelming. Break big tasks into manageable steps and celebrate your progress along the way. This approach builds confidence and helps you stay motivated. If anxiety is interfering with your daily life, relationships, or work, it's important to seek help. A mental health professional can provide support, guidance, and treatment options tailored to your needs. Remember, you don't have to face anxiety alone. If someone you care about is struggling with anxiety, offer your support by listening without judgment and encouraging them to seek help. Simple acts of kindness and understanding can make a big difference in their journey. Anxiety isn't just an adult issue. Children can experience it too. Signs include excessive worry, trouble sleeping, or avoiding activities they used to enjoy. Early support from parents, teachers, and professionals can help children learn healthy ways to cope. Technology can both help and hinder anxiety. While apps and online resources offer support, too much screen time or exposure to negative news can increase anxiety. Finding a healthy balance is important for your mental well-being. There's still stigma around anxiety and mental health, but it's important to remember that anxiety is common and treatable. Talking openly about mental health helps break down barriers and encourages more people to seek help. Recovery from anxiety is possible with the right support and strategies. Many people learn to manage their symptoms and lead fulfilling lives. Remember, progress may be gradual, but every step forward counts. If you or someone you know is struggling with anxiety, there are many resources available. Hotlines, online support groups, and mental health professionals can offer guidance and support. Reaching out is a sign of strength, not weakness. Anxiety is a complex but manageable condition that affects both the brain and body. By understanding how anxiety works and exploring treatment options, you can take steps toward feeling better. Remember, you're not alone, and help is always available. Take care of your mind and body, and know that recovery is possible.